Good day, my name is Lasang Ntweiwa. The role of a registered nurse has undergone significant changes in the recent years. On today's presentation, we shall discuss these changes and their impact on the roles and responsibilities of a registered nurse. We will also discuss the role of a nursing and the Nursing and Midwifery Council, that's NMC, in relation to the nursing practice. Furthermore, we will look into the importance of effective communication and effectiveness of the multidisciplinary approach in a healthcare setting. Lastly, we will discuss the implications of the Code of Nursing Practice. The role of the registered nurse. Number one, increase the focus on patient-centered care. The healthcare industry is shifting towards a more patient-centered approach, and registered nurses are at the forefront of these changes. Patient-centered care is all about putting the patient first, and registered nurses are expected to be more involved in the decision-making process, ensuring that the patient's needs are met. Number two is advancement in technology. The healthcare industry has seen significant advancement in the technology in recent years, and registered nurses are expected to keep up with these changes. Nurses are now required to have basic understanding of electronic health records, telemedicine, and other technological advancement. Number three, shortage in nursing staff. There is a shortage of nurses globally, and this has led to an increased workload for registered nurses. Registered nurses are expected to work longer hours and have more responsibilities, leading to higher risk of burnout and stress. Number four is a great emphasis on preventative care. The healthcare industry is placing a greater emphasis on preventative care, and registered nurses are expected to play more significant role in this area. Registered nurses are responsible for educating patients about healthy lifestyle choices and providing preventative care services. More advanced education and training. That's number five. Registered nurses are expected to have more advanced education and training, including a Bachelor of Science in Nursing degree. Many employers are now require registered nurses to have more Bachelor of Science degree, and some hospitals are now only hiring nurses with the Bachelor of Science degree. Now we will look on the Nursing and Midwifery Council. The NMC is a regulatory body that sets the standard for nursing and midwifery practice in the UK. It works to ensure that nurses and midwives provide safe and effective care to the public. One of the key roles of the NMC is to maintain a register for all nurses and midwives in the UK. This register ensures that only those who meet the NMC standards of education, training, and character can practice as nurses or midwives in the UK. It is also responsible for keeping the register up to date and ensuring that those on it continue to meet the standards for ongoing professional development. The NMC also sets the standard for pre-registration nursing and midwifery education programs. This standards ensures that all nursing and midwifery students receive a higher quality education that prepares them for their future roles. The NMC also approves and monitors these education programs to ensure that they meet the required standard. In addition to these setting standards and maintaining the register, the NMC also investigates complaints about nurses and midwives. It has the power to impose sanctions, including removing nurses and midwives from the register if they fail to meet the required standard of practice. This ensures that the public is protected from those not fit to practice. Despite its importance on the nursing practice, the NMC, though, has a number of weaknesses and challenges that include. The weaknesses are, number one, lengthy regulatory processes. The NMC regulatory process, such as investigations and fitness to practice hearings, can be time-consuming. Lengthy proceedings may delay the resolution of cases, causing stress for both the practitioners and complaints. Number two, communication and engagement. Some stakeholders have expressed concerns about the NMC communications and engagement with the nursing and midwifery community. Ensuring effective communication and engagement can help address professional concerns and maintaining a strong relationship between the NMC and the professions professions it regulates. The challenges include workforce pressures. The nursing and midwifery professionals face significant workforces and pressures, including staffing shortages and increased workload demands. These challenges can impact the NMC's ability to effectively regulate and support the professions in meeting the required standard. Evolving healthcare landscape. The NMC adapted the evolving healthcare landscape, including technological advancement, changing care models, and emerging healthcare challenges. Keeping pace with these changes and ensuring that regulatory remain relevant and effective can be a significant challenge. The NMC essentially provides guidance to nurses and midwives on professional standard and conduct. This guidance includes the code, which sets out the ethical standard that all nurses and midwives must uphold. The code provides guidance and professional behavior, communication, confidentiality, consent. It also sets out the standards of practice that nurses and midwives must meet, including the provision of safe and effective care. Now let's look on the code. This part of the presentation will elaborate more on the code, its implications on the nursing practice, and on the role of the registered nurse. The code is a set of professional standards development by the Nursing and Midwifery Council in the UK, which outlines the expected conduct and behavior of registered nurses and midwives. The code provides guidance on how registered nurses should carry out their duties and responsibilities in a professional manner. The implications of the code on the nursing practice, number one, is professionalism. The code requires registered nurses to demonstrate professionalism at all times. This means that registered nurses should uphold the reputation of the profession and be accountable for their actions. They should also work within their competence and seek assistance where required. Number two, person-centered care. The code emphasizes the importance of person-centered care. This means that registered nurses should take into account the needs and preferences of the patient and involve them in decision-making where possible. They should also respect the patient's dignity, privacy, and confidentiality. Number three, communication. This code highlights the importance of effective communication. Registered nurses should communicate effectively with patients, their families, and other healthcare professionals. They should also document all information accurately and clearly all the time. Number four is teamwork. The code recognizes the importance of teamwork in providing safe and effective care. Registered nurses should work collaboratively with other healthcare professionals and respect their expertise and contribution. Number five, that's safety and quality. The code requires the registered nurses to prioritize the safety and quality of care. They should identify and minimize risk to patients, take and take appropriate actions when incidents occur. They should also reflect on their practice and continuously improve their knowledge and skills. The code also expects the registered nurses to act as advocates for their patients, ensuring that their rights and preferences are respected. Registered nurses should also take an active role in promoting health and preventing illnesses. They should educate patients and their families on how to maintain good health and prevent diseases. They should also identify and respond to public health concerns. The need for effective communication. Effective communication is a crucial component of the healthcare system, especially in multidisciplinary healthcare settings. This setting involves the collaboration of different nurses, healthcare professionals, including physicians, nurses, pharmacists, physical therapists, occupational therapists, social workers, and many more, working together to provide comprehensive care to patients. It is essential because it ensures that all members of the healthcare team and are on the same page and working towards a common goal, the best possible outcome for the patient. When communication is poor or lacking, there is a higher risk of errors, misunderstanding, and poor patient outcome. One of the key benefits of effective communication is improved patient safety. In a multidisciplinary healthcare setting, different professionals need to exchange information regarding patient care, including diagnosis, medication, and treatment plans. Effective communication helps to ensure that each healthcare professional has a clear understanding of the patient's conditions, medical history, and any relevant information that can affect their care. Effective communication also help to reduce the risk of medical errors. Miscommunications or lack of communication can lead to errors in medical administration. Incorrect dosages and misused diagnosis, this can lead to serious harm or even death to the patient. Effective communication ensures that all healthcare professionals are aware of their roles and responsibilities in the patient care, and they are working towards the same goal. Furthermore, it also promotes a positive work environment, reducing stress and promoting job satisfaction among healthcare professionals. When communication is clear and concise and respectful, it helps to build trust and respect among members. This in turn can lead to improved collaboration, job satisfaction, and better patient outcome. As it is widely known that there is two sides of a coin, the multidisciplinary approach is no exception. It has its positive and its negative. Firstly, let's discuss the positive of this approach. One of the main advantages is that it ensures that all aspects of the patient's care are addressed by involving healthcare professionals from different disciplines. The patient receives a more holistic approach to care, which takes into consideration not only the physical needs but also to the psychological and social needs. Another positive aspect of the multidisciplinary approach is that it promotes better communication and collaboration between healthcare professionals. This leads to prevent errors and reduce the risk of complications. However, there are also limitations to this approach. One of the main limitations is that it can be time-consuming and may reduce additional resources. For example, scheduling meetings between healthcare professionals and from different disciplines can be challenging, and coordinating care can be difficult. Additionally, there may be differences in opinions, communication styles between healthcare professionals from different disciplines, which can lead to conflicts and misunderstandings. This can have a negative impact on the quality of care provided to the patient. Despite these limitations, the multidisciplinary approach has been found to be effective in improving patient outcomes. Studies have shown that this approach can lead to better clinical outcomes, such as a reduction in hospital readmissions and increase in patient satisfaction. To sum up the presentation, we will once more touch on all that was discussed on today. Registered nurses are now expected to be more involved in decision-making process, keep up with advancement in technology, handle an increase in workload, focus on preventative care, and have more advanced education and training. As the healthcare industry continues to evolve, it is important for registered nurses to stay up to date with these changes and adapt accordingly. Going on, the Nursing and Midwifery Council plays a crucial role in ensuring that nurses and midwives in the UK provide safe and effective care. It sets the standard for nursing and midwifery education, maintaining the Register of Nurses and Midwives, investigates complaints and provides guidance on professional standards and conduct. The code emphasizes the importance of professionalism, person-centered care, communication, teamwork, safety, and quality. The code sets out the expectations for the role of the registered nurse, who is responsible for providing safe and effective care and acting as an advocate for their patients and promoting health and preventing illness. Furthermore, effective communication is essential in multidisciplinary healthcare settings. It helps to improve patient safety, reduce the risk of medical errors, promote a positive work environment, and ultimately lead to a better patient outcomes. The multidisciplinary approach is an effective way of providing comprehensive care to patients. While there are limitations to this approach, the positives far outweigh the negatives. By promoting better communication and collaboration between healthcare professionals, the multidisciplinary approach can lead to improved patient outcome and a better quality of care. Thank you so much for listening to my presentation. I hope this was informative. Thank you.